Thanks for this latest installment. So I'll talk a little bit about gratitude, but in talking about gratitude and the term positive psychology in general requires a little bit of a backdrop or foundation. I've talked about this a little bit in some of the other programs that we've had. But when we talk about gratitude, positive psychology, decreasing stress, this all fits under the general umbrella term concept called lifestyle medicine. So I'm a member of the American College of Lifestyle Medicine. They have great information online and on their website. And these are considered the 6 pillars of lifestyle medicine. Gratitude and often falls under the category of managing stress. But all of these pillars really fit together and they influence each other. So for example, Walk with a Doc was developed as a way to increase physical activity. And many of you probably already know that increasing physical activity itself can reduce stress levels. It can help improve sleep. It can help promote a sense of well-being, and it might lead you to eat healthier. It can certainly help maintain relationships if you're being physically active with someone else. It's a really positive, healthy thing to do with others, friends, family members, etc. But gratitude falls under, generally speaking, this way of managing stress, which is to say that we constantly deal with very stressful situations, very stressful parts of our life that tend to focus our thinking or our experience more in the negative frame. And focusing on gratitude is a way to shift away from that negativity and as a result to put more emphasis on positivity. And we all have the power to do this. Developing practices that promote gratitude can be really powerful. Just to go in a little bit more detail about that, we've talked in the past a little bit about why we experience stressful situations, like what's the benefit of us feeling stressed out, and it's actually to help us survive. So we evolved over many, many, many years to develop these bottom parts of our brain that are built to pick up on threats to our safety or well-being in the environment. So way back when in the jungle, our predecessors might have felt the threat of an injury or a predator, and we developed this stress response or fight or flight response so that we can respond to whatever threat it is that exists in the world. The challenge, especially today with so much going on in a busy 2021, is that many, many, many stressors are present at the same time, but they all lead to the exact same activation of the stress response. So many years ago in our predecessors, our blood pressure would go up, our heart rate would go up so we could run away from a predator. Now those same changes take place, but the consequences are much more serious because the stressors don't go away. And so the effects of the stress are much more chronic and much more ever present. Chronic stress leads to the development of obesity, high blood pressure, diabetes, chronic pain syndromes, anxiety and depression, etc. And each of these chronic diseases that are driven at least in part by stress can then be even more stressful on top of the original stressors that many of us experience: physical illness, mental illness, traumas, financial difficulties, marriage and divorce, trouble with family or children. And so this cycle develops, which I sometimes call the stress symptom cycle, where stressors cause symptoms and diseases cause more stress, and people get stuck in this loop. And in fact, I would say most people are stuck in this loop. And this is a very negative psychological loop, that in this loop, we're constantly worrying, stressing about things, trying to escape, trying to numb. And that experience in and of itself can be really bad for our health in general. In particular, these negative impacts of chronic stress are mediated or brought on by inflammation. So this is a diagram that shows that when we experience stress, it activates parts of the brain that ultimately turn on immune cells that cause inflammation in the body. So the takeaway is that chronic stress leads to chronic inflammation, which causes chronic symptoms, chronic diseases, and all of that just causes even more stress in addition to the beginning stress. The good news is, though, is that we have the ability to engage with the stressors that we experience in the world in a way that's actually much more productive, much more positive, and as a result, much better for our health. So instead of activating the parts of our brain that are necessary for the stress response, we actually have the ability to stop and to pause and to activate different parts of our brain, parts of the brain in the front that are associated more with compassion and understanding, perspective, and they lead to what's called the relaxation response. The relaxation response has the opposite impact on the body. It causes blood pressure to go down and heart rate to go down. It causes a positive influence on the immune system, not all the inflammation that I mentioned before. And this loop ends up being really, really good for our health. So when we pause and activate the relaxation response, when we shift away from the stress response, we can improve our health. And so again, this is part of a strategy for managing stress, that we can develop strategies that shift us away from the stress response and more towards the relaxation response, or in general, positive psychology. So we won't talk too much more about the relaxation response today. We can talk more about it in the future, and I've already done one session talking about it in the past. But that's really where practices like meditation, yoga, tai chi, even some crafts or hobbies, that's where that really comes into play. What we'll talk about today, though, is developing strategies for reducing stress and promoting positivity that are related to gratitude. So gratitude is the appreciation of what is good. Some people will say what they're grateful for. Other people can write down what they're grateful for. And in fact, some people, myself included, even keep what's called a gratitude journal, where you make a regular practice, a daily practice of writing down things that you're grateful for. When people keep a gratitude journal, they often start each entry. Usually people will write up one or more typically 3 entries per day. And each of those entries will start with the words, I am grateful for. And there's research that shows that actually when you spell out very clearly the things that you're grateful for, when you say, I am grateful for something to yourself, that actually activates those front parts of the brain that I was just talking about before. So this is an imaging study from an MRI research lab that looks at which parts of the brain light up, meaning that they're activated when people are experiencing gratitude. And this is a flip of what I showed before, but basically this is the front part of the brain, this is the back part of the brain. And these researchers showed that this area in the front part of the brain gets activated when we think of things that we're grateful for. And so this is very, very similar to the relaxation response, where now the brain again is flipped. So the front part is on the right and the back part is on the left. But when we activate these front parts of the brain, that's what turns off the stress response, shifts us away from negative thinking. The world's going to end. The weather's so bad. My family members are so annoying. These are the negative thoughts that keep us spinning in the stress response. When we shift towards more positive, the snow outside is beautiful. I'm so grateful to have my family members. I'm fortunate I have a roof over my head. That type of shifting is what shifts the brain activation to the front part of the brain here and can help offset or turn off the stress response, which is quite negative. So just to finish up, I would encourage all of you to take even a moment right now to pause and think of, you don't have to even think of 3, think of one thing that you're grateful for today. And in your mind, just say to yourself, I am grateful for. So it could be, I'm grateful for something as simple as, I'm grateful for the food I had for lunch. I'm grateful for a weekend to spend some time outside. I'm grateful for a message I got from a friend this morning. It can be anything small, or it could be much bigger, something much more grand. But just take a moment to think about something that you're grateful for right now. And even if there's a small chance that that one thing you're grateful for makes you feel even a little bit better, a little bit more positive, there's science to support that. You're activating the front parts of your brain. And one thing you can consider doing is to keep a gratitude journal where you write 3 things you're grateful for every day. Start each one out by writing, I am grateful for. If you want to be a pro, you can take it to the next level and you can actually text friends or text family members what you're grateful for about them or about their relationship. You can spread the gratitude. There's evidence that shows that that takes the benefit even to a higher level. But I'll finish here just by saying that I'm grateful for your time and attention listening here today, and I'll open up for any questions if you have. That's a really good question. People interpret depression in different ways, but yes, there is a definition or a diagnosis of clinical depression or major depression, and it's actually very common. Up to a third of all adults will experience depression at some point in their life. So depression is very common, and it's also very, very treatable. Not everyone with clinically diagnosed depression, meaning talking to a doctor, getting the diagnosis of depression, receiving the diagnosis of depression, excuse me. Not everyone with depression needs medication. There's very good evidence that some people benefit fully just from either talk therapy with a licensed therapist, or by doing self-care practices like meditation and gratitude journals, etc. But for anyone who is concerned about depression, certainly talking with a medical provider about the individual specifics is the best next step. I'm a primary care doctor, and I have a lot of patients with depression. I have a lot of patients with anxiety. For many people, those symptoms have gotten worse over the pandemic. So it is very common, but it's also very, very treatable, fortunately.
And it's wonderful to know that in medicine today, that they recognize more of this mind-body connection in our whole health and all dimensions, including, our well-being and mental health. In the same way you'd have a physical ailment that you'd want, to kind of look into treatment. It's wonderful that, we can accept the reality that it's natural to have a whole range of emotional experiences. So I think that was a great question.
Yeah, and like I said, technically or medically, there's a difference between the range of emotional experiences and what's diagnosed as depression.
Yes.
But both the range of clinical or the range of emotions that are considered quote unquote normal and depression have a very strong mind-body connection. And in fact, the lifestyle medicine I was talking about before is really critical. So when we talk about healthy eating, there's a blossoming field including led by one of my colleagues on what's called nutritional psychiatry, the impact of food on mood. When we talk about physical activity, there's a very clear understanding that increased physical activity, as the comment just said, can certainly boost mood. And a lot of people with depression or anxiety get tremendous benefit from regular physical activity. I drink Dunkin' Donuts coffee, but the fact that there's a Dunkin' Donuts everywhere means, people are built to in our community to wake up early, to go to bed late, to drink lots of coffee. Again, nothing against Dunkin' Donuts, but it's in our culture to definitely not get enough sleep. And there are many, many negative health consequences as a result of that. So when we talk about the importance of stress reduction, healthy eating, regular activity, restorative sleep, that can go a very long way for both preventing anxiety and depression, but also for treating it. Again, in certain circumstances, medications are either very helpful or in some cases essential, but the lifestyle medicine approach can be really impactful for many people. It's an excellent observation, and it comes up a lot. The biggest answer I would say is that the reason I think we assume that our minds are kind of hardwired for negativity is that that's what we see in our culture. So the news cycle, for example, when was the last time you watched the news and the breaking news was about something good that happened, right? Mm-hmm. And when you open the newspaper, when was the last time that, the front headline was something good that happened? Mm-hmm. Not to say that bad things don't happen and that we shouldn't pay attention to them, but our culture is built in many ways on overemphasizing negative things and underemphasizing positive things. Similarly, a lot of issues around when you think about structural forces at play in society, structural racism, gender imbalances, and inequalities, health inequities. When you think about all these structural issues, many people live and experience our culture in a way that has some sort of negative experience built into it. So for women who experience gender inequalities, for people who are non-white and experience racial inequalities, for immigrants who experience xenophobic, have experiences of xenophobia. Unfortunately, we live in a culture that has many prejudices built into it. So I would say a lot of it is really not a personal reaction, that we think and we experience what the culture is, not so much what we are.
Oh, interesting.
And so we're bathing in negativity, unfortunately. And what I would say is, as a result, we get to the point where we have years, if not decades, of negative messaging. You're not thin enough, you're not strong enough. I'm not talking about you, Stephanie. I'm just saying in general, you look on the, yeah, exactly. You're not fast enough, buy these shoes, buy this, you're not pretty enough, buy this makeup. I mean, all of this messaging is really about what people are not enough. And then you open the news or the newspaper and here are the things that are not good. And so we develop this negative cycle, this stress response of something's wrong, I need to respond.
Wow.
And so it becomes a pattern. The reason that gratitude practices and healthy lifestyles in general are so important is that they start to counteract that pattern response. So by spending time every day to focus on things that we're grateful for, that starts to counter program what naturally happens in our society. So in contrast, basically the messaging is to contrast, to teach ourselves and to re-engineer the experience, because so much of it happens as a default in our society, unfortunately.
I'll quickly share an opposite story where my boyfriend's grandma is probably the most positive person I know. And we've been talking to her just every evening. And I'll say I leave the conversation just with this sense of like calming and happiness. And it wasn't even my positive thoughts, it was just listening to her talk about her day and how she just puts this positive spin on everything that just kind of makes you feel a little bit more calm and relaxed as well. So
definitely. Yeah, exactly, Ashley. Just like negative thoughts and experiences and messaging is very is kind of transmissible. I try not to use that now with the virus, but it spreads among people. Positivity actually spreads among people as well. So that's why what I mentioned, the highest level of gratitude, when you share gratitudes with other people, it's thought to have a highest benefit or a higher benefit to you individually, because we're built to connect with other people. And so when you combine the positive thinking with the social connection, they actually amplify. So she's probably getting a lot of benefit sharing with you, Ashley, but you're getting benefit too. And now we're all benefiting because we're hearing of this story. So it spreads. The positivity can definitely spread. Yeah.